Hello everyone, welcome back on Meds. I'm your host, Mr. Meds, aka King Meds, and Kosia Makambi. So today's video is gonna be a quick one. On my three previous videos or Meds talk videos, I have discussed three molecules, which was paracetamol, I discussed aspirin, and then the last two videos were ibuprofen. So what I said on my previous video is that when it comes to combination, what I will do is I'll discuss the molecules, then discuss the combinations that are available that might have uh, the ingredient that I've already discussed previously. So this is gonna be the case. So today I'm gonna discuss the combination of ibuprofen and paracetamol because I've already discussed paracetamol. Um, I've already discussed ibuprofen as well, so I'm going to discuss combinations of ibuprofen and paracetamol that are available in the country. Fortunately, there is no combination of aspirin and ibuprofen. The combination of aspirin and paracetamol I've already discussed on my other video. Uh, there is no combination of aspirin and ibuprofen. I mean, that combination wouldn't make sense. As I said, you can't use two anti-inflammatories together. So in this case, we have paracetamol and ibuprofen. Paracetamol, as I said, it's a painkiller, but not really an anti-inflammatory. As I said, paracetamol is not really an anti-inflammatory, but when it is combined with other painkillers or other anti-inflammatories, then it can have what you call a synergistic effect. What that means, instead of getting 1 plus 1 equals 2, then 1 plus 1 is equal to 3. That means that the two molecules are more potent together than as individuals. So that's why you get a lot of paracetamol combinations. It does this to almost all painkillers. You'll get combination of paracetamol with almost every painkiller. You get like a paracetamol anti-inflammatory combination. You get a paracetamol codeine combination. You get a paracetamol tramadol combination. That shows how effective paracetamol is when it is combined with other molecules. It might not be as great when it is used on its own, but in combination with other molecules, it is actually very effective. The other good things with combination is that when you combine two molecules, the two molecule might be more effective in lower doses than when you're using one molecule that you might need to use higher doses. For example, when it comes to paracetamol and ibuprofen combination, to have a one tablet that contains 250 of paracetamol and 200 milligrams of ibuprofen might be more effective than, let's say now, 400 milligrams of ibuprofen on its own. So the combination of two molecules usually gives a better result, and obviously because you're using lower dose, then you are less prone to side effects of those two molecules. But that doesn't mean they won't exist, but they are less likely to happen as compared to when you're using the single molecule on high doses. When it comes to paracetamol and ibuprofen combination, there is quite a lot in the market. However, they come in different quantities. So what do I mean when I say they come in different quantities? There is 250 paracetamol and 200 milligrams ibuprofen combination available. And as I said, that is the most common one. You will see that one a lot compared to others. Then you get 350 milligrams paracetamol and 200 milligrams ibuprofen combination. And then the last one is 325 milligrams paracetamol and 400 milligrams ibuprofen combination available. All these combinations, although they have different quantities of ibuprofen and paracetamol, they are all indicated for the same purposes. So you can basically use it for any kind of pain that include your migraine, your toothache, your period pain, your headache. What else? your arthritis, spot injuries, you name them. You can use it for any kind of pain, fever, and inflammation. They will work. It will just depend on a person. One combination might be more effective to someone compared to another, just because people are different. One combination is more likely to respond better to one person than another. They are basically used for the same indications. And when it comes to scheduling, the molecule in the combination that has the high schedule will actually dictate the overall schedule of the combination. For example, in this case of this video, there is paracetamol and ibuprofen. Ibuprofen is higher schedule than paracetamol. This means the overall quantity that you can get over the counter will be dictated by ibuprofen, because ibuprofen sits on a higher schedule than paracetamol. Yes, you'll see when I'm discussing all the combinations available in the country, you'll see how this works. If this doesn't make sense to you, please rewatch the paracetamol and ibuprofen videos. The combination will actually make more sense if you first watch those two videos. And then there's also another video that might help a bit, the scheduling video. I think that video is actually the foundation of everything that we are discussing on this MedStock series. So when I talk about scheduling, that video explains everything about scheduling, what is scheduling, and everything about the schedule. So you can just check on my videos and just check on the scheduling video, rewatch that video and see if this scheduling topic makes sense to you. When it comes to contraindications, because this is a combination of ibuprofen and paracetamol, I've already discussed the contraindications on ibuprofen and paracetamol on my two videos, paracetamol and ibuprofen videos. The combination will have contraindication of both the paracetamol and ibuprofen. This basically means if you have any of the contraindications that I've discussed on paracetamol and on ibuprofen, then you cannot use these combinations. So I won't discuss them again. You can just go and watch those two videos and see who cannot use this combination or who can use the combination. I won't discuss them again. Now let's move to the next topic. So our next topic will be the common ibuprofen and paracetamol brands that are available in South Africa and their pricing. So remember, when I discuss the pricing, I'll be discussing the single exit price. The single exit price is the price before VAT and dispensing fee. So although it won't differ that much from the real price, because the dispensing fee is actually regulated. They cannot charge so much dispensing fee, so they can charge as they like. So it won't be too much of a difference, but I just can't tell you how much it will be overall, because each pharmacy has its own dispensing fee that they charge, so it will vary according to pharmacy. So let's start with the 250 paracetamol and 200 milligrams ibuprofen combinations. So as I said, this is the most common combination. This is one that you'll probably get a lot of. If you buy like over the counter, you'll probably get a lot of these combinations over the counter. They are one of the best-selling anti-inflammatory and paracetamol combination, or ibuprofen and paracetamol combination. So these combinations include Mypaid, you get Panado Plus, you get Ibupain, and then you get Ibugesic Plus. Actually, those are the 4 brands available in the country. According to my source, these are the only 250 paracetamol 200 milligrams ibuprofen brands available in South Africa in South Africa. So It's only four of them: MyPaid, Panadol Plus, you get Ibuprofen, and Ibuprofen Plus. Those are the only four brands available in the country at the moment. So how many tablets can you buy uh, on this combination? So as I said, the molecule with the highest schedule dictates the overall schedule of the combination. In this case, it's going to be ibuprofen that dictates the overall schedule of this combination. So because we have 200 milligrams ibuprofen in these combinations, that means you can get up to 60 tablets or 60 capsules of ibuprofen over the counter without a script. If you want more than that, then it becomes schedule 3. Then you need a script for it. And when it comes to dosing of these capsules, then you can take 1 or 2 capsules 6 hourly after meals for not more than 10 consecutive days. And then when it comes to pricing, I'll just discuss the single exit price of 30s. However, Panado Plus doesn't come in 30s, so it comes in 20s and 50s. So I'll only discuss it the 20s of Panado Plus, then the other ones obviously come in 30s, then I'll discuss the 30s of those. So when it comes to Panado, the single exit price for the 20s is 50 rands 97 cent. I'd say it's a bit expensive. And then MyPaid, which is like the cheapest of them all, comes in 54 rands 21 cents for 30s. And then there's also Ibuprofen, which is about 60 rands 3 cents for 30s. And then the Ibuprofen Plus, which goes around 59 rands 99 cents for 30s. So as I said, Panado is a bit expensive than the others, but yeah, it is still the same thing. Panado Plus, not Panado, not just the Panado, it's Panado Plus. Whenever you get a brand name that comes with something on the side, you must always question yourself, what does that mean? For example, now if you know Panado and then you get one that says Panado Plus, you must always ask, what is that plus stand for? So in this case, the plus means an extra ibuprofen. So that's why it's called Panado Plus. But it comes in 20s. As I said, the 20 is about 50 rands, 97 cents. And then there's MyPaid of 54 rands, 21 cents. And then the Ibuprofen, which 60 rands 3 cents, and Ibuprofen is 59 rands 99 cents. So these are not really expensive combination. They are actually quite affordable. So as I said, you can buy up to 50s. In boxes that comes in 30s, you can buy up to 2 boxes. The Panado Plus that comes in 20s, that means you can buy up to 3 boxes. And then there are some brands that have a quantity of 6 already. I know MyPaid comes in 60, and Ibuprofen as well comes in 60, and Ibuprofen have 60s as well. So you can buy up to 60 capsules of these combinations. Now let's move to the next combination, the 350 paracetamol and 200 milligrams ibuprofen. These two are what we called equivalents. They are not the same, they are not generics, but they are what we call equivalent because they can basically do the same job. They are indicated for the same purpose. It's just that they are the generic must always have the exact same quantity of ingredients. When it comes to milligrams, they must always be the same. So the moment that the other one is higher than the other one, then it's called equivalent. So you can use them basically for the same thing. There isn't much difference between them. But some people might find the other one more effective than the other one because of just slight difference in one of the ingredients. For example, in this one, the 350 paracetamol, this one is a bit more paracetamol than the other combinations that we have discussed. Some people might find this one more effective for them than the previous one that we've discussed. But it is basically gonna be used for the same purpose at the end of the day. but there is only one brand of these one on the 350 200 milligrams ibuprofen. There is only one brand available in the country, and that is Ibumol. Ibumol comes in a pack size of 18s and 30s. Yes. When it comes to dosing of this one, it is basically the same as the one I've discussed above. You can take 1 or 2 capsules every 6 hours after meals for not more than 10 consecutive days. So there isn't much of a difference between the two. Yeah. So, but you can't take more than 2 capsules at a time. So on this one, like I've discussed on the previous one, you can also get up to 60 tablets or capsules over the counter without a prescription. Anything more than that is gonna be on prescription. You see on this one, the only change that they made is on paracetamol, which is actually one of the very low schedule painkillers. So the change in paracetamol in this case doesn't have any effect on the scheduling. But if it happened that we changed the ibuprofen, then that might have affected the quantity that you can get over the counter. But because now it's just paracetamol that have changed, that doesn't affect the overall quantity of tablet that you can get over the counter without a prescription. Now let's discuss the single exit price of the Ibumol. So the Ibumol comes in a tablet form. Other than the other ones that I've discussed that comes in a capsule form, Ibumol comes in more of a tablet form. But it comes instead in 2 pack size, the 18s and 30s. The 18s have a single exit price of around 46 Rand 61 cent, while the 30s comes in 77 Rand 69 cent. As I said, this is a single exit price. This is a price before VAT and dispensing fee. So when you go and buy it at your local pharmacy, it might be a bit expensive than this, because this price doesn't include those VAT and dispensing fee. The reason why I'm not including that is because the VAT is the same, but the dispensing fee varies from pharmacy to pharmacy. So I won't be able to tell you how much it costs, because every pharmacy might have their own pricing. Then there is one last combination that is picking up. I say picking up. It was previously not selling that much, but now it's actually picking up. That is the combination of 325 paracetamol and 400 milligrams of ibuprofen. So this one there is only one brand available in the country, and that brand is called the MyPaid Fort. So MyPaid Fort contains 325 milligrams of paracetamol and 400 milligrams of ibuprofen in it. So when it comes to quantities that you can purchase over the counter, you can only purchase 30 on these ones because of the ibuprofen quantity in that one. So as I said, you see now the ibuprofen this one has 400 milligrams of ibuprofen, whereas the previous ones that I've discussed is 200 milligrams. If you go to my ibuprofen video, I said when it comes to 400 milligrams tablet of ibuprofen, you can only get up to 30 tablets. That's why on this one you're also able to get 30 tablets, not more than that. It's because of the ibuprofen in this content of ibuprofen in this combination. So on this combination, you can only get up to 30 tablets without a prescription. If you want more than that, you can only get it on prescription. And my paid forte, I know there is actually a lot of confusion because the Medicines Act has been recently updated. It used to be 15 tablets that you can buy over the counter without a prescription, but now they have amended the quantities of ibuprofen that you can buy over the counter from 5 to 10 days. Then now you can get up to 30, the same as the previous one we've discussed, the 200 milligrams ibuprofen combinations. Those one used to be that's why I still get pack size of 30s, is because it was previously you could previously purchase up to 30 tablets over the counter without a prescription, but now the quantity that you can get without a prescription have been amended. Now you can get up to 60 on a combination that contains 200 milligrams of ibuprofen, and then 30 on the combination that contains 400 milligrams of ibuprofen. And when it comes to dosing, this one you can take 1 or 2 tablets every 6 hours after meals, but not more than 6 tablets a day, and should be after meals as well, and should not be used for more than 10 consecutive days without consulting a doctor. Then the single exit price for my paid fort, then for 30s it's gonna cost you 115 rands 12 cents. That is a single exit price. Remember, single exit price, the price before VAT or the dispensing fee. Then there is suspension combination. There only one combination, and that combination it contains 250 milligrams paracetamol and 200 milligrams of ibuprofen in every 10 ml. So that is also schedule 2, as I said, not schedule 2, and you can only buy 1 bottle over the counter. And this is indicated for children over 2 years old, and the dosing is obviously age or weight based. And yeah, it's indicated for, as I said, for children over 2 years old. So I won't be discussing the dosage and all that. You can refer to the package inside for dosing because it's weight and age based dosing. Other than that, you only get about 2 brands of the paracetamol ibuprofen combination suspension, and that is basically the Ibumol and the Lotem. The Ibumol, I think, is the most common one. Most people will know the Ibumol suspension, and that is basically a combination of paracetamol and ibuprofen. Ibumol comes in 2 flavors, grape and banana. Both cost 76 rands 2 cents per bottle. That is a single exit price, a price before VAT and the dispensing fee. And then when it comes to Lotem is also one of the available products in the country. So it's also like a combination of one of the generics, combination of paracetamol and ibuprofen. So it costs about 88 rands 34 cents per bottle. So Lotem is a bit expensive, but yeah, I mean, they do the same thing. It's up to you what you prefer. If you remember on my ibuprofen video, I said ibuprofen belongs to 4 schedules, which is schedule 0, schedule 1, schedule 2, 3, and 4. But I said I won't discuss schedule 0 and 1. I'll discuss it on this video because schedule 1 and schedule 0 are occupied by topical gels, which means there is no oral formulation that is schedule 1. Everything that I've discussed that is oral formulation, either syrup, capsule, or tablet, is schedule 2, 3, or schedule 4. Injection is schedule 4, actually, not really tablets. Injection, which is schedule 4. Schedule 0 and schedule 1 are occupied by topical formulations. So now I'm going to discuss those topical formulations available. There's only one brand of ibuprofen topical gel available, and that is Deep Relief. That's the only brand of ibuprofen topical gel available. When I did my research, I saw that there was previously a Nurofen topical gel, but it's now discontinued. It's not available anymore. The only available one is the Deep Relief, which is a generic. Basically, the Nurofen was the originator in the market, but now there's only Deep Relief. So deep relief is indicated for those um, deep muscle pain, injuries, spot injuries. You can use for that. You can use for bone pain as well. If you feel like there's a skeletal pain or joint pain, you can use that deep relief applied on the affected area and relieve those pain and inflammation. So when it comes to scheduling of this gel, the quantity determines the scheduling. So anything that is 50 grams or less, it comes in a package of 50 grams or less, is schedule 0. This means all these items you can get, all these quantities you can get it in the front shop. You don't even have to go to the dispensary for that matter. You'll find them in the front shop shelves. You can buy them without a prescription. Anything that has a quantity of 50 milligrams, 50 grams or less, that is available without a prescription. You can buy the checkers as well. 50, 60 is available. You can see them there. You can buy it at any retail shop. They are available without a prescription or without going to the dispensary. And then schedule 1, anything that is above 50 grams, then it becomes schedule 1. So that's why you'll find that if you want, let's say 100 grams of the deep relief, you only get it at the dispensary, but a 50 gram or 30 or 20, I don't know, you find them in the front shop. It's just the quantity that determines the schedule when it comes to the topical gels or the ibuprofen topical gel. As I said, it's only the only available one is the deep relief. Okay, I think I will leave it there for today, but I know I'm not producing these videos fast enough, but I would like you to use these videos like as a reference. If you buy a product in the pharmacy, you can just use these videos as a reference. I think I'm putting enough information here for you to be able to know what to do and not what to do. And even if you're going to the pharmacy, this video will help you to know where to get the product, roughly how much you're gonna spend on a product, and how many can you actually get without a prescription. Are you gonna need a prescription or not? If not, how many can you get without a prescription? So just save these videos, use them as a reference. If you have any question, you can ask the question on the comment section below. Any suggestion as well, suggestions are also welcome. Put them on the comment section below. Other than that, like, share and subscribe. Stay on meds for more clarity, not confusion, one med at a time. See you on the next one.